When he became the Minister of Health, or as I say, the Coordinating Minister of Health and Social Welfare, he had certain ideas and talked about all the plans and goals that were going to be achieved in the space of 1 year. Amongst them, the primary healthcare centers are going to be improved upon. It was going to bring about an increased investment in the health sector. It was also going to be talking about the fact that Nigerians can be assured of some health insurance coverage or access to health, as the case may be. How well has this been achieved? Is it possible that there are some areas that they were not able to do much? Well, the statistics tell us that there's been some bit of improvement, and in the space of all of this, the Ministry of Health has gone ahead to carry out a survey, as they call it, a voice survey of thousands of Nigerians across the country. Approximately 42,000 households were also reached to find out what they need and what has been provided for them. Can we get the minister to tell us more about this? Yes, indeed. He is our guest on the program today, and he'll be taking us through the journey from when he came on board, what has been done, what needs to be done, what challenges they have, ultimately to ensure that Nigerians have access to adequate health cover. Newsnight sat for a conversation with the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. He talks to us about what he met on ground, what's been done, and what's possible in the years ahead. Professor Mohammed Ali Pate, thank you for speaking with us on Newsnight.
Thank you for having me.
You know, it's always a pleasure to have you because you are one person that makes conversations very easy to have. Maybe because you follow through on everything you say, and then when you asked again, like, I said this then, and we're doing it. So we'll start off from that point. This is like this second, let me use the phrase, missionary journey in the health sector in Nigeria. And I know the last conversation we had, you talked about certain parameters. And so if you can just give us a refresher on about 30 or 40 something KPIs you set for yourself. Let's just run through that. Then we can just run us through. What were those KPIs you set for yourself when you came into office? It's over a year now. So tell us about that.
Yes. After we came into office, under the leadership of the president, knowing his drive, his vision that he articulated in the Renewed Hope agenda that has health of Nigeria at the center of it, we did a thorough diagnostic exercise. We also listened to Nigerians, we listened to stakeholders, and we articulated an agenda whose goal was to save lives, reduce physical and financial pain, produce health, and to do so for all Nigerians. And we had four pillars and 3 enablers: to improve governance, work together with states, local government development partners, to improve transparency, accountability, to strengthen our regulatory bodies, our regulatory function, and to respond to our citizens' needs. Secondly, to improve population health outcomes, to do health promotion, prevent diseases in a multi-sectoral way, but also expand primary health care, expand human resources, expand health insurance, and expand health infrastructure. And thirdly, to unlock the healthcare value chain, to get us on the path to medical industrialization across the value chain on the basis of good science. And fourthly, to strengthen Nigeria's health security linked to regional security and global security. We also articulated 3 cross-cutting pillars. One was on digital transformation as an enabler. And secondly, to different the financing of the health sector. And fourthly, to orient the talent and culture within the sector. So that the performance, we use performance management systems across the chain. Just as we are accountable to the president and he is accountable to Nigerian people, we also have to have internal accountability mechanisms. That was the frame, what we set out, and we unveiled that health sector renewal investment initiative in early December, where the president witnessed federal government signing with all the 36 state governors, with the development partners, 17 of them, and more after that, on a compact to improve population health outcomes for Nigerians.
So in a space or in an environment where many times conversations or statements are made or declarations, even launches, unveilings, big events are held, and at the end of the day, implementation of those things is a problem in itself. Even those whom you have signed the compact with will now be your, how do you say that, Achilles heels. So what has it been like since in that 1 year?
I think right from the beginning, we flipped the script. Instead of 90% on policy planning and 10% on execution, we flipped it. We said 20% time in policy planning, which we did, very thorough job, consultative, inclusive, but we know right from the beginning, our focus is on execution, it's on actions, it's on getting things done. And with matrices, with measurement, with clear, incontrovertible indicators that will be measured. And we had measurements in 2023. We also have the benefit of a demographic and health survey, which is a tool that measures the state of health of a population for 46,000 households that were sampled in a systematic way and administered questionnaires to understand the state of health. So that's almost another checkpoint. And then over time, we will be tracking that. And by agreeing on certain core matrices, certain key indicators across the saving lives angle, across the reducing physical pain, reducing financial pain, promoting or producing health, as well as doing so for all Nigerians across the pillars. There were indicators that we identified that were measurable. And those indicators, we began to track them. And this year, in fact, this week, we have conducted the first joint annual review, which is looking at the state of health report, informed by two pieces of information, which tells us the progress that Nigeria is beginning to make. So I can tell you what we have done in outputs, in the processes, but I can also begin to tell you what we are beginning to see in terms of outcomes. But this is still early in our journey, so there is a lot more to come ahead. So we have the DHS, but this year we repeated the population survey, the perception of Nigerian population, so that it's not only what we are saying or what the epidemiologists and experts statisticians are saying, but 2,600 Nigerians were interviewed rigorously from all the states to ask how has, with the same instrument, what has changed in the last 12 months. And we have very interesting results, and that is what gives us confidence that in fact we're on the right track by measuring and by discussing those measurements openly.
So I was going to ask you the households, but you've taken us to the individuals, 2,600. But so how do you go now? Let's start with the households.
Yes.
46,000 households. That's infinitesimal compared to the households in this country and across board. So tell us how those 46,000, how did you decide on the 46,000?
Yes. So first of all, it's very prevalent to use anecdotes to frame a narrative. Stories, one story then clouds everything. But you cannot go to all the households in Nigeria and interview each and every one. That will be tedious, that will be costly. So we have an instrument called the DHS, the Demographic Household Survey, which is done every 5 years. The last one was 2018. We then had it repeated in December 2023, which asked those households that were sampled systematically.
The same households that were sampled in 2018?
No, but it's a population sample.
Okay.
So the idea is that when you get information from that, it's representative, that there are no systematic biases, and that it's credible. It's probably the best instrument that we have to track things like child mortality. So I can tell you some good news, which prevailing narrative may say, things are getting worse. But in reality, what we have seen is that by 2023 December, we've reduced child mortality in Nigeria by 16.7%. And we have data now across different states to know the pattern, which states have improved, which states have had less improvement, and in fact, which states have deteriorated. We've seen, for instance, modern use of contraceptives have increased in 17 states. 6 states have doubled: Imo, Ogun, Ekiti, Nasarawa, Gombe, and one other state have doubled their use of modern contraceptives. We've seen states that have also improved in terms of full immunization coverage, but we have also seen the overall increase in full immunization coverage, almost 10%. but we have seen increase in children that have 0 dose. So that's not very good news, particularly in the northwest part of the country. So we can disaggregate and say, compared to where we were, here is where we have had improvement, and here is where we have challenges. We have seen improvement, I will tell you, on diarrheal diseases, almost 40% reduction. We've seen 30% reduction in lower respiratory infections. We've seen less significant, but nonetheless improvement in HIV, from a low base anyway, and also on malaria, almost 5% reduction despite population increases, despite resistance, despite the issues of climate change. When we looked at the perception survey, which is the People's Voices survey, is different from going to a hospital and asking people, what's your experience of the health system of that particular hospital, which may be clouded by how they were treated in that particular, what their mood is, and other issues that they're facing. By asking the population that is randomly selected, their perception, whether they've used health care, whether they've visited a facility in the last 12 months, what they used it for, what their experience has been, we get a fairly better idea of what is going on. And the interesting thing is that we saw that the confidence of Nigerians on the health system in terms of this direction is about half. And that more than half, 54%, are confident that the government is now competent to deal with health emergencies. The proportion of those who feel the quality of care is poor in primary healthcare centers has dipped slightly, and in tertiary hospitals has dipped slightly, less so in the secondary facilities. Overall, maybe those who were interviewed were being generous. The perception of the quality of care overall is good, either in the skills of the providers or in terms of the waiting time that they have experienced or the physical infrastructure they've seen. Not perfect, but I think Nigerians are opening up the idea that the health sector is on the verge of improvement. But there are not so good news. The not so good news is that the cost, the affordability of healthcare has become a challenge. Even if utilization, and this came from this survey, that the utilization of diabetes screening, more Nigerians check their blood pressure, adults. More Nigerians screen for cancers in the last 12 months. Unfortunately, less women have gone for mammography, perhaps because of the cost. But the affordability, the cost of care is turning out to be an issue which we now have to work on. So the point is not to say that everything is good or everything is bad. The point is not to even judge who, where, but is to know what do the citizens feel about health. And where do we need to do more? What are we doing well that we can continue? That is the idea. So combining the DHS data that we have, which is disaggregated by states, and we shared with all the 36 states their own scorecard across key domains of immunization, maternal health, primary health care, all of those, as well as what we now know on the perception of Nigerian citizens. We feel that we are onto something because the president embarked on a renewal of the sector as part of a vision for Nigeria that will emerge out of the current difficult times to be a prosperous, peaceful, people-oriented country. And we feel that 1 year on, that the work that we do at the Federal Ministry of Health and our agencies, the work that state governments, their commissioners and their agencies, and the state governors themselves, the work of our development partners, civil society, private sector, that collectively, by working together hand in hand, we're beginning this journey of transformation, and we're beginning to see movement that, if sustained over time, that we can see major improvements.
In terms of child mortality, or infant mortality, or is it maternal mortality, about 19 states, if I'm correct, were seen to be like the epicenter of mortality. Please correct me if I'm wrong.
We have 172 local governments that account for 50% of maternal mortality based on previous data that we have. but on the sustainability. So you see, this is where leadership comes. Ordinarily, because there have been several failed promises in the past, Nigerians have reason to be skeptical when you come and say, we will change this. But here we have, with the president who has farsighted and seen a transformation journey, not just one transaction, but that over his term and in the context of Nigeria's history, he wants to put on a trajectory. And over time, we will look back and see how far we've come. That is leadership. And he has 4 years. We've just done one. And after the 4 years are done, believe you me, on this path, Nigerians will find it compelling. You have another 4 years. And the direction that he has taken in terms of the decision that he has, even if his teams change, but the course is set, the North Star is identified, and the states have signed a compact on a dotted line, and there are structural mechanisms like the joint review that we have, which will continue on an annual basis, not just one-off. The surveys will continue, the measurement will continue. In addition to that, it is a plan that doesn't have resources attached to it. It's almost like fiction. Here we had an ambitious program with goals. We then have annual operational plans that each of the states have now developed, costed, identified their own resources, what federal government is contributing, and the gaps. That is the AOPs. And we mobilize external financing. You recall in 2023, when the president unveiled the Renewable Investment Initiative, the development partners led by the US government announced $3.3 billion in complementary contribution over 3 years. Now, much of that has been, now we see it. We've seen the Global Fund with its commitment. We've seen the World Bank approving a concessional financing, what the program they call HOPE, which has a large chunk of it is on health as well as governance. And we hope the education part will also come later. And we have seen grant financing from various entities, Gates Foundation and others, bilateral funders, who may have been skeptical at the beginning, but they've come around to put resources on the table. So with that mechanism, with the structures that we put in, with the sector-wide governance mechanisms, the coordination office, the appointment of the coordinator, the routines that we have set up, the quarterly performance dialogue, the fact that we're engaging citizens, over time, we believe that the momentum will only increase, and that is the point of leadership. What the president is doing is not doing, let's say, making everyone happy, but he's doing what is important for this country's trajectory to be different. And that therein lies the sustainability of it, because right now, I can tell you some states on their scorecard, they do very well. Some have regressed. And that is a wake-up call. It doesn't mean that next year, those that have regressed will not come back up and do something better. And overall, if we continue on that path, even when I'm done as a minister, whoever comes after me would also have to look at what is working and build on it, and where I have fallen short, then they'll correct it. So they also build on that. Today at the Joint Annual Review, we took a moment to recognize all the previous health ministers who laid important foundations, right from Oliko Ransom Kuti, all through H.I. Lambo, Babatunde Oshotimehin of blessed memory, others, Isaac Adewale, Onyebu Chichikwi, Professor Onyebu Chichikwi, who is coming tomorrow to the JAR, Isagi Ohanede, because each one of them as a leader built on what their predecessors had done, and we are where we are. So for this moment, our ambition is to further enhance the trajectory so that Nigeria's health measurably improves.
Especially in the face of the economic hardship Nigerians are facing. Some will say, well, blood pressures around the country have gone up since fuel subsidy was removed. Electricity tariff has gone up there, so people are, can we find some form of relief? And now you're painting a picture of relief out there that they are. So the question about accessibility to health comes in here, because it's one thing to have access to the hospitals, and another thing is to have access to the medications that are required, or access to the doctors when you get to the personnel that you need to diagnose whatever it is that's bothering you. But before you get to that part, let's step back and look at the facility itself, the primary healthcare centers. I mean, that's one of your major, how do you put it now? Indicators. I think you mentioned that as one of the major indicators you're going to have to deal with across the country to improve on the primary healthcare centers, revive the ones that are dead and enhance or renovate, revive the ones that are dead and improve on the ones that are functioning right now. So what's the situation right now?
So
if we can get the numbers.
I'll give you the numbers on that. And before I do that, let me say that 1,000-mile journey starts with one step.
I remember you said that the last time.
Yes, so you have to start moving. And we have started moving. And it is not to be taken for granted that we'll get to destination. But it is almost certain that if we continue with the movement that we're making, we'll be much further ahead than where we are. We can stay in one place, and we could have done that for many years, but now we're beginning to move. What we're hoping is that we'll build on the momentum collectively so that we go even faster to where we need to go. On the primary healthcare revitalization, since the last time we met, we've had 3 rounds of disbursements of BHCPF resources, almost 45.9 billion naira of federal resources through the state governments to direct facility financing to the primary healthcare centers. When we met, those disbursements had not happened, so that these facilities are receiving on a quarterly basis a subvention. And through NHIA, hundreds of thousands of Nigerians have been added to the Vulnerable Groups Fund, concretely, which means they are better able to afford care. And NHIA can give you their names and where they are located. We've seen increase by 2.4 million Nigerians who have been covered by publicly financed health insurance, NHIA, as well as the state health insurance schemes. Less so on the private side. That is tangible. We've seen increase in women. In fact, there was no program for women who have obstetric complications. But we have seen at least 20 facilities, several HMOs signing an MOU with NHIA, and women who are already having their fistulas repaired at no cost to them successfully at the VVF centers that we have in this country. That is an important move forward. We've seen the comprehensive emergency obstetric care centers and neonatal care centers identified, and the mechanism being put in place now to afford women cesarean section, for instance, if they need them. Then on the infrastructure, the revitalization, you cannot revitalize when there's no money. But even when you have the money, and we have about 290 billion naira deployed through the states for the revitalization that we say we'll make. But when you have the money, you can't just go and say, okay, this facility, here's the man, that's it, you're revitalized. So we took time to assess the facilities to understand which ones are level 1, which ones are level 2, that are able to offer 24/7 services, have a certain number of skilled birth attendants, have housing for health workers, have power, have water. So you need to distinguish them. And then the bill of quantities for the revitalization had to be developed for each facility, because one facility may need roof, a door, some benches. One may need a borehole, power, and a room for the health worker. So those are nuanced. And then the bill of quantities and the tender document be prepared, and the procurement process to be carried out diligently so that the resources are not wasted, and then no objection to be sought, so that the contractors are awarded, and then the contracts are concluded and paid. Now, at least 380 of those have been already completed. About 2,000 are in advanced stages. BOQs have been completed. The processes of tendering them is underway, and they will be awarded. And then, where are the health workers? So when we said we will retrain 120,000 frontline health workers, it's not to retrain them and leave them at home or leave them in the marketplace, but to retrain those who are already in facilities and providing services to Nigerians. And as of today, 43,000 frontline health workers have been retrained across the different states of this country, and more will be trained. So it wasn't just a rhetorical statement that we will retrain 120,000. No, and that training had to have the curriculum for the training developed in an inclusive manner, in an integrated way, updated information, the trainers have to be identified and trained, the training manual developed, and the training guide and what they would be using also developed. So we are moving in a thoughtful manner, in a way that gives us confidence that if sustained, Nigeria's health sector will be much better during this president's first term than it had been. And in the future, if Nigeria sustains that the health of Nigerians will be much better.
You've mentioned a couple of things that are quite interesting. One of them being that you have had to reach out to the previous ministers of health to come in and look at what they've done, and then, okay, how each one has built on the other, and you're booking all of that together into what you're doing. But there's something you said, and I know you were about to make another point before we went on that break. So let me let you go back to making that point before we went on that break. Then I'll bring up that thing you said about the portal. It's just the portal.
Yes. So when we talk about improving population health outcomes, there are things that we do on the health care infrastructure side, the primary health care, the secondary care, the tertiary care, the human resources, what happens in the clinic. Well, we are a ministry of health, not a ministry of sickness or ministry of disease. And because of that, we think of the health of all Nigerians, which means the 200 million Nigerians who don't go to a hospital are apparently healthy. We want to keep them healthy. Those who may be sick but don't know yet that they are sick, we want them screened so that we know early that they are sick, a few hundreds of thousands or a few millions. Then there are some that are sick and they know they are sick. We want them to afford access quality healthcare services. So we declared health promotion as an important player in that second item of our agenda. And 2 weeks ago, we had the first National Health Promotion Day, and it's the first in the world, where we dedicated a day to health promotion. And we launched alongside the 36 states and the FCT an effort that we called Know Your Numbers and Control Your Numbers, so that we aim to reach 10 million adult Nigerians to check their blood pressure, check their blood sugar level, check their cholesterol, control those as a way of keeping Nigerians healthier so they don't need to progress to complications, whether kidney disease or heart disease or stroke or other complications. So I wanted to bring that. In addition, the multi-sectoral element, when my colleague, former Minister of State, now moves to education, I'm so excited because education also has a bearing on the health of Nigerian population. It is uneducated mothers or mothers who have primary child education that have the most children who are under-immunized or have zero dose. They're the ones more likely to miss antenatal care. They're the ones more likely to actually have less skilled birth attendants and have higher maternal mortality.
And you forget that it's the uneducated fathers that will stop them from even going for their antenatal.
Exactly. So education is as important. The same thing with environment. And I'm so glad that the new Minister of State for Health is actually coming from the Ministry of Environment, because environment and exposure and cleanliness, hygiene, water and sanitation, stopping of open defecation, nutrition, agriculture, they have a bearing in the health of a population. But when you focus only on the sick, you're looking at the individual who's already gone sick. Well, we have youthful population. You go, whether you're in Lagos or Abuja, you'll see very healthy Nigerians active, doing their businesses, going to their trade, going to teach, going to work. We want to keep them healthier. That's why we discourage smoking, excessive alcohol, avoiding sugar, eliminating trans fat, reducing salt intake as measures to keep the Nigerian population healthier, while also strengthening primary health care, secondary health care, and tertiary health care. So on the primary health care portal, what I was mentioning to you is as part of this effort to revive the primary health care, it has to be backed by evidence. So there's a portal which the National Primary Health Care Development Agency has developed and is populating with credible data, where you can click and see the PHCs in your state, in your local government. You'll see their pictures, the officer in charge, the profile of the PHC, what services are available, and that portal is a very exciting development because over time we can be able to, you can check where do you want to go, what services are available where. And if I can give your viewers a clue.
I was going to say that you should please don't waste time. We're about to, the festive periods are around the corner. Nigerians do a lot of travel, especially now that air travel is very expensive. So a lot of Nigerians are going to be going by road. They would want to be able to get to a location, there's a PHC, a primary healthcare center, or be able to access some form of healthcare or the other. So what's that portal?
So it's https://phc.mphcda.gov.ng. I think if you look at that portal, it is being populated. It is not 100% complete, but at least we're beginning to compile that.
Yeah.
And we're recruiting what we call PFMOs and the health fellows who will be useful in social accountability, who will be deployed in local governments, and they will help complement missing information. They can take the picture of the hospital and correct whatever information for those that are in their domain. And these are facilities that are enjoying the federal resources, the BHCPF funding. So it's the 8,800 initially, and as we progress in terms of functionality, you can be able to track them. At a minimum, even in your community, at least you can look at it and correct that in your community if it's not complete. So it's not about saying, they didn't mention that there's a borehole in this facility. Well, if there isn't, bring it to our attention. We'll inform, if it is factually correct, then we'll add it so that we collectively co-create a health system that works for us.
So what you're painting here is a picture that where every Nigerian is part of the health of the process of monitoring the health of Nigerians.
Exactly, because producing healthier Nigeria is not something that only President Bola Ahmed Tinubu will do, or his ministers, or the civil service, the Federal Ministry of Health. It is something that we have to build consensus that health is important for us as a people. The President has set a vision, but we have to act. And so state governors have to also pay attention to the PHCs in their facility, the secondary facilities in their domain, the health workers that do. Local government that have their autonomy statement by the Supreme Court have to ask themselves, as chair of the local government, are my PHCs functional? Are the health workers qualified? Do they have the commodities? How do I match up with the federal government so that I get the most of those?
Are there plans for counterpart funding? Should local government come up with an initiative towards the health sector? Are you considering that?
The BHCPF has 15% requirement of local government and 25% counterpart by states. We are hopeful that they will be meeting those up. And for the state health insurance schemes, where requiring, in fact, that they have their own equity contribution, that they put some money on the table. Because the BHCPF, the 45 billion that I mentioned, it's coming from federal government's own contribution, of the federal government's portion of the federation account. So we expect, of course, that the states and local government will contribute, because the political will has to be at all levels. That's why we're a federation, and it's not a unitary system. But beyond that, even you, as a member of the media, you have a responsibility in helping co-create a healthier Nigeria. If you educate people to make sure their children are immunized, if you point them to good, credible information, if you educate people on how to promote their health, you are promoting the creation of a healthier Nigeria. Civil society, if they ask local government chairman, Mr. Local Government Chairman, why is the PhD in your local government not working because there are no health workers? They are playing the role of accountability in helping create that. Just as minister, I'm focused on setting the vision, raising the resources, ensuring the standards, tracking the execution, and others should play their part.
You know, there's something that I think it was you or the president that said I was focusing on leveraging on the, let me see that, leveraging the economic potential of every sector to create jobs for Nigerians. We know that there have been a lot of the Japa syndrome, something that's in the Nigerian space. We've had a lot of medical personnel trained in Nigeria leave the country for greener pastures. Now, the president is saying he's going to leverage on the economic potentials of every sector to create jobs. Would that happen if there are no expansions of our infrastructure in terms of like education infrastructure, including the curriculum, and then the health facilities where these people can come out and get to work?
I think what we've been trying to do is to optimize, to play catch up, because much of the infrastructure investment that we should have done many years ago, we are just now beginning to do them. So whether it's in the primary healthcare centers or the teaching hospital and tertiary institutions, we needed to expand them to cope with the burden of disease that we're seeing. And this president, as part of this investment initiative, approved the expansion of 6 cancer infrastructure and equipment with world-class equipment in each of the geopolitical zones of this country. He approved it. It was appropriated by the National Assembly. We signed the agreement with NSIA. They went to the original equipment manufacturers, and the groundbreaking has happened, and 2 of those will be ready by May 2025. And there are non-health jobs which link to the 3rd pillar of the president's agenda to unlock the healthcare value chain. While he is thinking across sectors, but in health in particular, we set up an initiative to unlock the healthcare value chain across the spectrum. Because under that initiative, if we can produce pharmaceuticals, test kits, some biologicals, assemble medical equipment, and go faster on digital transformation in our sector, we'll create jobs. There'll be thousands of jobs of young qualified Nigerians domestically. That is the value chain. Not only create jobs, but some of the economic value will be retained, and the Nigeria's health security will be more assured.
But in a situation where we have taxes being increased, multiple taxes in some parts of the country, multiple taxation, then we have issues of power supply, where the pharmaceuticals may not even have power enough to do the productions that they need. The manufacturing industry, the manufacturers are shutting down because of power and the demand of the economy to even keep their industries running. Is that also being considered in the expansion of investment?
So you see, we're working to provide solutions. And this exact point that you mentioned, if you had said it 12 months ago, I would say, yes, these are issues. And there are still issues. It is a difficult environment to do business, and any business person will tell you. But it is not going to stay like that forever. And one bold step that was taken was the executive order that was signed by the president, which has been gazetted for the first time, eliminating tariffs but on raw material that are imported to manufacture stuff in Nigeria, on manufacturing equipment for the first 2 years, and allowing us to shape the market through volume guarantees from contracts. The signal is out there.
So is the signal also being put out to those who were somewhat shutting down and leaving the country, the Smith Klein Beachams of this world?
Oh, you see, things have moved on. 2 weeks ago, I received a delegation from GSK. They asked to see us, and they came to explain that all the brouhaha about GSK leaving Nigeria, they didn't want it to be linked to what we were trying to do. In fact, they appreciated what this government, they understood it, that we want to locally produce things. And now they are beginning to explore with their new business model how GSK product can come back to the Nigerian market. Believe you me, any sane business entity anywhere in the world that you tell that there is a population of 230 million people who are educated, who are dynamic as Nigerians are, who are entrepreneurial, who have the leadership that we have, and that this country will grow, it will be a very wrong bet to bet that Nigeria will remain where it is a few years ago. So even those who have left, I'm sure they will be reconsidering. But more importantly, there are those who have stuck with us, who are already manufacturing. And we have a Federation of Nigerian Pharmaceutical Industry Actors, FENPIA they call them. And Dr. Okpa, who joined me and the whole group in Maiduguri recently, they put a container load of pharmaceuticals and donated it through us to the Borno State government for the flood victims. Why did they do that? Because they are very appreciative of what this administration is trying to do to incentivize local manufacturing, because as businessmen, they know that the government will have their back. Is it easy? No, it's not easy. But believe you me, therein lies the competitive advantage. Because anybody that goes into producing things, now that foreign exchange is limited, when things get better, they will be further ahead than somebody who is coming in line.
Mr. Patrick, you've painted a beautiful picture, and it's really interesting here. As we wind down, as we begin to wind down, rather, two things come to mind. Improvement here, improvements there. So access to this thing, I'm going back to the question of access now. You talked about the National Insurance Health Scheme and the states have their own. So how easy is it for Nigerians to access it? Can I just get up and go access healthcare knowing that there's insurance somewhere? I mean, in other climes, it's expected that you as an individual, at whatever level, you'd have a level of insurance cover. How is that working out, federal and state, as the case may be? And then, is there a place, maybe you missed out this part in the course of all of this, is it possible you missed out a place where Nigerians can help to shape the health policies across the country, from federal to state to local government? Since you're working with all of them, is there a place Nigerians can reach out and say, okay, hey, Professor Pate, this is what I think can happen in my neck of the woods and will improve what you're doing?
May I? You've been asking me lots of questions. I will ask you one question. I hope you keep it on camera. Do you have health insurance?
Yes, I do.
Aha. Here we go. So you have health insurance. We found 16 million Nigerians had health insurance when we came. Now there are upwards of 19 million Nigerians, 2.4 million as of the third quarter of 2023. Is that enough? That's a good leap, but it's not nearly enough for a population of 200 million. So we need to do more faster. But to insure somebody has to pay the premium. And that premium either comes from federal government, state government, or employers or individuals who can afford it. So for the poorest Nigerians who don't have an employer like Channels Television, somebody has to pay, and government is focusing on the Vulnerable Groups Fund to ensure those at the bottom actually have access to affordable care, while the private sector and employers also step up, and states also step up.
Nigerians want to contribute to the policy, the health policy across the nation.
Yes.
How can they do their own contribution?
There are several ways and platforms where Nigerians are contributing. In developing this blueprint, for instance, we had a series of engagements with civil society organizations. There's the Nigeria Health Sector Reform Coalition, there's the UHC 2030. We engage with traditional and religious leaders. We visited facilities, even participants of the interview that we did for the People's Voices as well. So 5,000 Nigerians' views in a structured way were captured. We also have ways for feedback to be provided, but importantly on the social accountability. Because someone who doesn't know health financing or is not a health person, they are limited in understanding perhaps some of the nuances of where Nigeria is and where it should go. But as users and as principals for us, they have a responsibility in holding actors accountable. So the social accountability, for instance, paying attention to the health facility in your domain. And when in the local government, the primary healthcare system center is closed, you don't come to federal government and ask. You ask your local government chairman who is elected, or ask your commissioner of health.
Or can the feedback go on that portal that you talked about earlier?
I think there is, for the fiduciary part, we in the federal government, for the federal government part of it, we have set up a mechanism, a hotline, which I don't have it off it, but where Nigerians can call, for instance, if there's a fraud, if you find somebody colluding to divert federal money that is sent to primary health care center, you can call. And we're paying close attention to those kinds of things to ensure that whatever kobo or naira is sent by the federal government to the front end as much as possible, as much of that resource gets to services. Now states may have their own ways of collecting that feedback. Mind you, we're a federal republic, or a federal system of government, and the federal government has its role, and states have their role, and local governments have their role. But it's the citizen that is the ultimate, because we're a republic, and the citizen is supreme. So the citizens' engagement, the activation of the citizen to hold actors accountable is key part of what citizens ought to be doing more, and at all levels. for what. So if Nigerians in local governments ask their politicians, well, we are sending ABC, you are giving us ABC today, but our women are dying because they lack good quality health care. What are you doing as local government? What are you doing as state government? Political leaders will pay even more attention to this issue. And that's the role of citizens to do, to respond to the needs of citizens. And I think for us, we've set it up now that has the sort of the technical and technocratic, the bit of the political angle, the leadership of the president and the governors, the financing, and also the social accountability and the responsiveness to citizens' needs. But it is left for Nigerians now to also own this agenda, speak about it, and you as members of the media, even discussing with you, you are shaping the discourse because you can set the agenda, you can shine light on things that may not be. And I urge you and all your viewers and other colleagues to study the state scorecards, to look at which states have improved, which ones have not improved, which ones have remained the same, on different matrices of the DHS, and to use that to engage the leaders, ask them questions as to what they are doing to respond, or what have they done well, and how have they done it so that others can learn. And to look at the data over time, not just report on actions when they've happened, but proactively shape the dialogue on health. That is how, as a country, we will create the healthcare system that will work for all of us.
All right. Thank you very much. Thank you.
Thank you.
Thank you.
Well, our show has to come to an end at this point in time. I want to thank you for letting us be a part of your day. Hit us with your comments, your feedback. Our handles are right there on your screen. And then you can also go back and watch this conversation again. Check what he said as against what's on ground. And look at all the other conversations that there might be. That's youtube.com/channelsweb or channelstv.com/podcast to get started. But we'll bring you a fresh edition of the program, same time. Till then, it's bye-bye.